Thank you, ma'am. Thank you, everyone.
Now we have Dr. Hitesh talking on orbital mucormycosis radiological findings.
Good afternoon, everyone. My topic is correlation of ocular and radiological findings in rhinoorbital cerebral mucormycosis patients. Rhinoorbital cerebral mucormycosis (ROCM) is an acute, fulminant, and lethal opportunistic saprophytic fungi. The exponential rise in the incidence of ROCM is due to certain predisposing factors like diabetic ketoacidosis, solid organ transplantation, prolonged corticosteroid therapy, hemochromatosis, patient with HIV, neutropenia, malnutrition, and hematological malignancies. Normal phagocytic activity in immunocompetent host provides an adequate barrier against the infection. The angioinvasive fungal infection affects the paranasal sinus, presenting as fever, headache, facial pain, nasal discharge, nasal obstruction, and crusting, progressing within hours to days to have orbitofacial and intracranial extension. The patient who has symptoms and signs of ROCM is treated in the treated COVID-19 patients, diabetes mellitus, use of systemic corticosteroids, and mechanical ventilation or oxygen supplementation is considered as a possible ROCM. Probable ROCM is when the clinical symptoms and signs are supported by a diagnostic nasal endoscopy or contrast enhanced MRI or CT findings. It is called proven ROCM when the clinical radiological features are coupled with microbiological confirmation on direct microscopy, culture, histopathology with special stains or molecular diagnostics. Early suspicion, rapid diagnosis, and initiation of treatment determine the prognosis of mucormycosis that can have devastating implications of the patient's survival. This is a retrospective cohort study. 45 positive RT-PCR patients were taken in the study. Histopathologically or microbiologically diagnosed cases of acute ROCM are from the Department of Ophthalmology, Otorhinolaryngology, and Radiology. Relevant clinical and imaging data from the medical records of patients were reviewed and analyzed. Data collection was from April to September 2020. It was analyzed from August to September 2023. Results: this study includes 45 patients with 36 males and 9 females. Out of those, diabetes mellitus was the most commonly associated risk factor seen in 21 patients. These are the rest risk factors. Most common symptoms were headache in 38 patients, followed by fever, facial swelling, and periorbital edema. Common clinical findings were ptosis, proptosis, cranial nerve palsy, total ophthalmoplegia, and central retinal artery occlusion. Maxillary sinus was the most commonly affected sinus, observed in 35 patients, followed by parasinusitis was detected in 17. Combination of maxillary ethmoid and sphenoid sinus involvement was noted in 21, maxillary ethmoid in 10, and ethmoid sphenoid in 4 patients. Based on the proposed strategy of ROCM, 14 patients were in stage 2D, followed by 13 patients in stage 1D, stage 3C each, 13 patients in both stage 1D and 3C each. 8 cases were in stage 3D, and extracranial extension noted in 3 patients. Mucormycosis is an opportunistic, potentially devastating angioinvasive fungal infection also known as zygomycosis and phycomycosis of the family Mucorrhizaceae. It is a saprophytic fungi. It grows everywhere. But infection rarely occurs as a patient, only if the patient is immunocompromised. The spores, when they inhale, it germinates, and formation of hyphae is seen. As ROCM is the most common presentation in mucormycosis. Depending on the immune status of the individual, most patients in the study has non-specific signs like sinus tenderness, headache, fever, malaise, and signs like ptosis, proptosis, and cranial nerve palsy was observed. These are the pictures of total ophthalmoplegia, orbital cellulitis, and involvement of left orbital apex. Ethmoidal sinus is an important route of infection since mucormycosis invade through this lamina preparation, gain access to the orbit and other contents. These are few CT images showing bilateral maxillary sinus involvement, ethmoid and sphenoid sinus involvement, right lamina preparation involvement, right orbital involvement, frontal sinus involvement, and also brain involvement. Ophthalmoplegia is associated with extraocular muscles and was seen in 13 cases. Cavernous sinus thrombosis was common intracranial manifestation noted in 3 patients. All the patients were started on IV liposomal amphotericin B infusion, followed by they were converted to oral antifungals, posaconazole 300 mg from 6 weeks to 3 months, depending on the clinical and radiological regression. Orbital decompression was performed in 2 patients. This is the post-op picture of a patient having orbital decompression done. It is a retrospective study with a limited number of patients. Few clinical the final conclusion of the study is initiation of empirical and antifungal therapy should be started in the probable stage of the disease, not wait for the microbiological or histopathological confirmation of the diagnosis, which helps in better patient recovery.